morning, everyone. I'd like to thank everybody for participating. And the first thing I believe I need to acknowledge Her Highness Saika Musa, Dr. Hanan, Professor Asma, and Dr. Ajayeb, because I think they are the people that had the vision to make the biobank, and it's the people that are pushing the biobank forward, which is a very good and very important structure for Qatar.
قطر بايوبانك وقطر جينوم هما عضوان في مؤسسة قطر للتربية والعلوم وتنمية المجتمع، ويعملان مع الجهات المعنية في قطر لتمهيد الطريق أمام إتاحة طب دقيق في قطر ودول الخليج العربي.
The vision of this program is to basically position Qatar as a pioneer in the implementation of advanced personalized healthcare.
When we talk about any disease, unfortunately, we don't see the hidden cost behind the disease. We only focus on how much it's costing us through our health system.
By identifying the features of the Qatar genome in order to develop individualized disease treatments and prevention medicines, we can improve medicine here in Qatar.
Our mission is to actually support original competitive research projects that address the Qatar National Research Strategy.
So this is an example where you collect a biobank for one purpose, and later on it can have a significant impact for other diseases.
Qatar Biobank is one of the most ambitious, fully developed protocol for phenotype participants around the world.
I mentioned it's all about maintaining the trust, and it's truly about maintaining the trust, because when we start with people's altruism, but also a sense of reciprocity. And what we hope to achieve is collaboration not only on a scientific field, but between all the different stakeholders.
Each one of us and each community and each group has specific values which are dear and near to them that they don't want to sacrifice.
Another policy challenge about which there has been considerable discussion and debate is return of research results, if, when, and how to do it. And then a recent movement called the Bio-Rights Movement has raised questions about what rights participants ought to have in their specimens and data.
One of the main things that was key to emerge is thinking about how do you define phenotypes and how do you get information. And instead of doing a physical exam on individuals, they're actually linking the biorepository to the electronic health records of these participants.
The future really is now when it comes to biobanking. It actually now, through organizations like ISBER, through a number of different technology providers that have focused on developing biobank-specific technologies, there are a lot of resources that come to bear.
A well-qualified biobank is a critical prerequisite for high-quality genetic research, predictive and precision medicine.
The biobank, in my opinion, is the key mediator between the clinicians and the scientists.
The main mission is to boost scientific excellence. That's for all these S3 infrastructures, that's the main goal.
Doing whole genome, analyzing whole genome, finding the gene is not enough to prove the role of this gene, especially if it's not known to play a role before.
The role of CTCs has been controversial for a long time. However, there was a large meta-analysis of almost 7,000 patients published in Cancer Research in 2012 and clearly demonstrated that there is a prognostic value for these cells.
Human tissue and linked data held from routine health care and from clinical research, trials, cohort, etc., are necessary and valued resource for public and private sector research.
So our department has a ISO 15189 accreditation, and that means that the biobank that is completely integrated in the diagnostic process is also part of this accreditation.
If we look at the future, when we're thinking about banking, we have to look at what we're doing today and meet the researchers' needs today, but we also have to be looking to the future.
So our aim is to evaluate the association of selected SNPs found in previous published US studies with the risk of hepatocellular carcinoma in Egyptian patients, and to assess whether this risk is modified by age and gender.
The focus of our research here in our global biobank is really focused on precision prevention.
Pathology really started collecting tissue in a meaningful fashion. We then had to move with the times and develop the so-called bespoke or personalized biobank.
Networking is the environment where it appears the miracle that 1 + 1 is more than 2.
The importance of the biobank is to provide a high-quality biospecimen associated with the phenotypic data.
The general objective of this project is to increase the quality of patient care, because actually we have a tertiary care hospital, so our aim was to accelerate the impact of research for such care.
The mission of ICLDC is to understand, tackle, and prevent diabetes, and our vision is to be the first choice for providing quality diabetes services in the region.
So we have been organizing workshops. We are attending a lot of conferences in Africa to talk about projects and encourage other African partners and researchers. And I'd like to thank you all for your attention.